September Health Committee meeting in order. Let's all stand for the invocation. And Sasha, could you lead us, please?
Y'all bow with me. Dear Heavenly Father, Lord, thank you for this day. Thank you for safe travels today for all of our staff, for the council members and those in attendance. Lord, I pray that you lead and guide us to make wise decisions for the future of our nation. In Jesus' name I pray, amen.
Thank you, Counselor. Roll call, Shelley.
Mike Dobbins.
Here.
Dora Petzkowski. Sasha Black Fox Qualls.
Here.
Danny Callison.
Here.
Julia Coates. Here. Joe Deere. Kevin Easley.
Here.
Lisa Hall.
Here.
Johnny Kidwell.
Oh, here.
Daryl Legg.
Here.
Cody Poindexter.
Honey.
Joshua Sams. Mike Shambaugh. Melvina Shotpouch. E.O. Smith.
Here.
Kendessa Teehee. We have a quorum.
Thank you, Shelley. If you've had a chance to look at the minutes, I'd entertain a motion to approve.
Second.
All those in favor?
Aye.
Motion passes. On to reports. Claremore Service Unit, Mr. George Valer. Afternoon, George.
You have my packet, or my report there in your packet. We have started giving flu shots in our vaccination room, flu shots and COVID shots. Along with that, we're partnering with the Oklahoma State Department of Health to do some flu shot community events out in our drive-through. They donated a couple of hundred flu shots to us, so we're going to partner with them and open up in the event, at the event, to all community members, beneficiaries and non-beneficiaries. The other big thing we have is October 1, we're going to take possession of the our new leased space over at the annex, just west of the hospital. We're moving physical therapy over there in the physical. Brent has a physical therapy practice there now, and we're going to just move our physical therapy over there and lease that from him. That'll add about another 9,000 square feet to our hospital. So that's pretty exciting for us. We're looking forward to that. If you aren't familiar, our physical therapy department now fits inside the tables here. So this will be a really neat thing for our department and our patients. Any questions?
Questions for George? Sasha?
I just had a question after the meeting, if you don't mind to stick around.
Sure.
Thank you.
No problem.
George, how many beds are there at Claremore?
36.
What is the average, you call it census, average number of beds that are occupied?
Just under 2, 1.7 or 1.8 for the last couple of years.
So 37 beds, but on average, only 1 or 2 are occupied?
Yes.
Okay. Any other questions for George? Okay, thank you, George.
Thank you.
Okay, Dr. Steve Jones with Cherokee Nation Health Services.
Good afternoon.
Oh.
I think you already have my report, and I'll answer any questions over that in just a second. I want to give you a couple of updates. I spoke with Counselor Coates offline. She had a couple of questions last time about a process that we had put in place where patients could refuse some tests, and we modified that process. She brought some things to our attention that maybe we didn't think about, or our committee didn't take all in consideration. So just an update, that process has been under review and it has been changed. The patient now has the ability to, at each visit, they'll be asked if there's any testing that they would like to not participate in, and they can say that at each visit. So we've added that to our workflow because they do give consent, and if that something changes in the process of a year when they fill out that consent again, then they have the ability at each visit to change that. So just an update on that from the last meeting. We have implemented our text reminders. We're starting, as you know, we've already said we've started to see a decrease in no-shows, and that's continuing to decline. So that's a pretty good platform and tool that we implemented that's we feel like it's making a difference. We've also about 3/4 of the way through with our initial implementation of our forms and electronic signatures. So you're starting to see that in some of the clinics. We rolled it out one clinic at a time where patients can go up and actually digitally fill out their paperwork or get it online through the portal, I believe, and fill it out before they get there. So it does speed up the process a little bit, gives the patient a little more freedom to not sit there and fill out the paperwork there in the waiting room. So we're working on that. We're meeting with patients, finding out their views of it. We're seeing more and more increased usage of it as time goes by, and in the next month we'll have that rolled out to all the clinics. So it's a big change and something that's needed for a long time. Last thing is, this is our last month of the year, so we're busy getting everything ready and finishing up this year and getting everything ready to open up with the new budget that you so gratefully passed last time. So we'll be good stewards with that. Any questions for me on the report, I guess?
Danny?
Yeah, Dr. Jones, your 10-hour days that you're doing, I know at the Salina Clinic, I've always thought it was a great idea. Have you got any data to give us at that point on how that's worked out for you, or is it still too early?
On the 10-hour days, we've seen an increase because it opens up basically more hours in the week for patients to get care. It extends the hours beyond the 7 o'clock, around 7 o'clock, beyond the 8 to 5 hours. So we've seen an increase in that, and also we're flex time over lunch. So not everybody takes the same lunch. So we have that lunchtime available too. So it definitely helped our patients that have jobs that they can't get off for routinely, and their employers don't allow that time off. So we've seen an increase in usage of that. In the first little bit, it took a little bit to get caught up, catch on, but the 7 o'clocks went a lot faster than the 5:30 visits. So, yeah, it's definitely been a good thing, and it frees up space in the clinics because you're able to use more rooms per doc because you're flexing that time throughout the week. So not everybody's there at the same time. So there's more efficiencies that come out of it for sure. Yeah.
Satcher?
Thank you, Doc. Do you have a list of dates for our flu shot community events?
I do not have that with me, but we will be publishing it soon. Dr. Shepard is the one that works on that, and I know she's been working on it, getting all the dates put together. I think that she was also going to reach out and get a list of community events that you guys will be putting on so that we can participate in those. So.
Okay. One last question. Our sterile processing technicians, are they trained on site, or is that a certification program that they go through?
There's both. Some come to us already certified, and some come to us, I believe, that can be trained on site.
Okay. All right. Thank you.
Any others for Dr. Jones? Josh?
Mine's not really a question, but a comment. I know many know that me and my wife, we just welcomed a new baby boy this past Thursday. So just speaking on Dr. Dorsett and the nurses and staff there, they did such a wonderful job. And this was a different type of delivery for us. We've had all 4 of our kids there, but the level of care, level of professionalism there, they did a wonderful job, and we just want to send our thankfulness to them.
I'll pass it along. Congratulations.
Dr. Jones, what's the demand for COVID tests now?
It kind of comes and goes. You know, when school started back, we were seeing an increase in COVID across the clinics and an increase for testing. We haven't seen an increase in admissions in our hospital for COVID. We did have some positive tests in the hospital, but it wasn't due to COVID. So, but we did see a lot of positives come through, and people come into the clinics and have an illness and thinking that maybe they had sinuses or something like that, allergies going on. And, you know, we generally test, and we did see a lot of positives, especially right when school started. It's starting to decrease a little bit now, but it was on a ramp up there for about 3 or 4 weeks.
Okay, thank you, Dr.
All right,
Jones.
thank you.
Lisa Pivick from Public Health.
Good afternoon. It's very
afternoon.
always good to see all of you. You have our public health report in front of you. If you have any questions, I'm happy to answer those. I would just highlight a couple of things. Our public health staff's been working very hard to get additional funding opportunities to expand services. We received 6 new ones this last month. One in particular I'd like to highlight. During the summer in June, we had a visit from the USDA to Cherokee Nation, to the Food and Nutrition Services Unit. It was a great, successful visit, and I want to send a shout out to Chief of Staff Bunch and to Samantha Hendricks, who successfully were able to get us an internship pilot for $400,000 for USDA. So we're a tribal pilot site. They want to use us as an example if it works well and see if they can expand to other tribes. The other grants are working in public health resiliency and other areas like that. So happy to field any questions that you might have today.
Questions for Ms. Pivek? Danny?
Yeah, Ms. Letha, I was looking at your report. How does somebody, I know in your report it said something about helping elders and helping first speakers fill out all of these different forms and different things that they have online. How do they contact you guys, or how are you offering that so that we could get this out to these folks so that they can get this help?
Yeah, I can get you the number to call and the website to look at. Most of the work is done. That was on a funding opportunity from CDC that we had for the last 3 years, and it was highlighting a couple of counties as a pilot project: Adair, Cherokee, Sequoia, and Delaware counties. But we've started to expand out, so that's probably why you haven't seen much in your area. We're getting ready to do some more distribution of materials there for you. Mm-hmm.
Any others? Thank you, Lisa.
Thank you.
Moving on to old business, to unpending new business. Number 1, Julia, would you mind reading that resolution, please?
This is a resolution in support of the Principal Chief compacting programs, services, functions, and activities and ownership of facilities of the Claremore Service Unit, and I move for its approval.
I have a motion and a second. This would be a good time for discussion. Questions? Mike?
Chair, if it would be permissible, I would like to hear from Chief Hosin before we start and give us an overview of what's going on.
Thank you, Speaker.
Thanks, sir.
Yes, sir. Chief Hosin.
Thank you, Speaker, and thank you, Mr. Chairman, members of the committee. This is an exciting time, and I appreciate the council's consideration of this resolution, which really will begin a process that should conclude with the assumption of operations of Claremore Indian Hospital through the compacting process. Claremore Indian Hospital, and I mentioned this at the State of the Nation address, is part of IHS. IHS is now and has been full of men and women who are dedicated to providing health care to Native Americans. And IHS at Claremore has provided a great deal of quality health care to a great many of us. I've mentioned that I was born there, and many of you have gotten your health care services there. It's in a system, though, Mr. Chairman, that is not a system that is better than ours. In fact, our system is superior, and I think IHS would acknowledge that. They're laboring under a great deal of federal law and operations. They are laboring under a lack of adequate funding, whether it's the infrastructure side of it or the operations side of it. It doesn't mean that we can or should ever go it alone when it comes to Cherokee Nation healthcare. We've shown excellence by being in charge of our health system, but continuing to press the government of the United States for the resources that it should provide, and even as it falls short as a government, we don't fall short, or at least we give our level best effort. And I believe that Claremore will be a facility that achieves even greater excellence, that meets the needs of the Cherokee people and other IHS beneficiaries as a result of this process. Now, Mr. Chairman, this is the beginning of a process. This is asking the council to authorize my office to reach out to the Indian Health Service in a formal way and begin the compacting process, which really begins with an examination. It really begins with us looking at information and data and facilities and the whole, every aspect, rather, every facet of that facility to determine whether this is something we should take on, and I believe it is. I believe it is because we have the capacity to do it. As I mentioned, I believe we can run healthcare better. I think we're achieving excellence and raising the bar every single day. Dr. Jones is here, and he can speak in more detail to what that process entails, but this really is the beginning, not the end of the process of assumption of operations. We have to get in and see what we're dealing with. But what I know we're dealing with from our side is a team that's very capable, a capacity that's very, very high. And I certainly, Mr. Chairman, Mr. Speaker, every member of the committee, I wouldn't recommend this if I didn't think we had the capacity to take this on, make this facility even better, make it the kind of facility that's worthy of the men and women that work there, worthy of the patients that we serve there. And so, Mr. Chairman, I'd be glad to answer any questions. Dr. Jones, though, as we know, has much more expertise and experience in this area than I ever will have, and he's here to also make a presentation and to answer questions.
Thank you, Chief. Questions for Chief Hoskin or Dr. Jones? Sasha?
Good afternoon, Chief. During our discussion just previously, or briefly ago, I know this is still early in the game. However, I think communication goes a long ways. And with Cherokee Nation, we foster that culture of open communication, open dialogue. Is there something that we could maybe set up to have, as we talked about, town hall meetings with the staff, just so they can have some of those questions that they may have answered? I think there's a lot of uneasiness, a lot of worry, but if there's something that we could do to help ease that with them.
Counselor, I agree with you, and you and others had made some recommendations along those lines, and based on those recommendations, we're looking for dates now, and I do think a town hall format's appropriate. Anytime there's change announced, there's anxieties, and that's perfectly natural. We felt it best to be public and transparent about our intentions rather than get down the road on a process and then have to catch up with staff. But we're already going to be doing a degree of catch-up because there's already a lot of questions out there about what happens to the workforce and what happens to the day-to-day work lives of the individuals who are employed at IHS. And those are questions that are worth posing in an open setting. So we will do that, and we'll make sure the council gets those dates and move forward. And Dr. Jones, if at any time, Dr. Jones, you have anything else to add on that, please feel free. But that's our intent.
Thank you, Chief. Thank you, Chair.
Julia?
Along those same lines, I was around when we assumed Hastings, and I know you were as well, and you know, those same kinds of questions were coming up at that time. And do you anticipate that there are going to be sort of substantial differences between that takeover process and this one in terms of, or can that takeover process at Hastings kind of be kind of demonstrably a model for alleviating some of the concerns that employees and others may have? I know we have more tribes involved, you know, in as receiving services at Claremore than at Hastings, and I know that will contribute additional complexity to the process most likely, but just along those lines, can you do some kind of general comparison between the two processes?
Well, Counselor, and I was there on this body. I wasn't as close to that one in terms of having my hands on it as I will be on this one, but I do recall, and you may have had the same impression, that process, as big as it was, seemed to ultimately go smoothly. There were these questions, but I think it would be wise to look at that process, and I don't doubt, and Dr. Jones may want to speak more to that in terms of what his team has, the institutional memory from that time to bring to bear, but I saw a lot of good in that process, and I think we always want to try to be better, and so we'll try to do that. Dr. Jones, any comments on that question?
So we will be bringing some of the same folks that worked on that team will be on this team. Some of these processes are set out by IHS guidelines, and we adhere to those, even though we'll all be at the table. So those time frames, once we initiate the process, will be dictated by those guidelines that we have to follow through this process. So, but we are bringing in some of the same people that were instrumental in the Hastings compact, and they'll be part of our team.
Any others? Okay, we're going to move on. Excuse me, we're going to move on to the next resolution, number 2. Let's see. Oh, Mike. Okay.
I just had a quick comment. I think, from listening to other councilmen and hearing what everybody has to say and what constituents have to say, I think this is we're in a good place where, we're doing what we need to do to maybe educate the people of how we're going to do it. There's just a lot of unanswered questions, so I think this is the right way to do it. And, Chief, we had this conversation a couple of years ago about this very, topic, and, you were to be patient, and I know, from our past dealings that, the Cherokee Nation will do a good job in this. We've proven that. We take care of our people, and I have no doubt that, we're going to do the same here. But at the same time, I think this is the process that we need to go through. I think it's a wise way to do it. And I just want to commend both of you on this, and I support you 100%, and I just think it's going to be a great thing for the Cherokee people in the end.
Thank you, Mr. Speaker.
Any others? Okay. Huh? Yeah. We have a motion and a second. All those in favor, say aye. Aye. Opposed? Motion carries. We have one more item of new business that was not in your packet. I think Shelley should have dropped off a copy of it at your page. It'd be resolution number 2. Let's see. Joe, can you read that, please? Resolution number 2.
This is a resolution in support of pilot North Tulsa Primary Health Clinic in collaboration with Oklahoma State University. I'll put that in the form of a motion.
Okay. Discussion. We have a motion and a second. Julia?
I just want to say that both of these are, the at-large people in the Tulsa and surrounding areas are going to benefit greatly from both of these, and so I'm really grateful to everybody for thinking along these lines. Thank you.
I just want to say this one has been needed for a while. We've talked about this for about 4 years. So supporting this and talking to the local people, they are looking forward to it. Because our Cherokee citizens around there's a bunch, and they would have had to travel to your area or Oshaleta. So this is going to change that world, because we just got out of the food desert part of it. Now we're working on the health care part of it. So, but this will be really good. That's why I'm supportive of this. So thank you.
Any others? Dr. Jones, I assume it's a partnership or in collaboration with Oklahoma State University. They own the facility, OSU does?
Initially, we're going to have a pilot location to start with, and just to start the process of building a clinic there, so building a practice.
Mm-hmm.
But we want that to be open to everyone, so the beneficiaries we would see and take care of, the non-beneficiaries OSU would see and take care of, but we want it to be seamless when a patient walks in the door. So that's why this is a kind of a new design. That's why it's a pilot project. It's a new format that we've not done before. So it's going to be something we're all going to learn as we walk through this process.
Is it this clinic located in the Honor Reservation?
It is located, currently the plan is it's going to be located on the corner of OSU's campus, so they can supply the infrastructure that we're going to need as far as utilities, things of that nature, security, parking, all of the things that you need. And then as we develop it, then we'll decide later if there's going to be a different location. But this is a pilot project, and it's something we're going to step into lightly and learn as we go and start building and work in conjunction with the other healthcare people who deliver healthcare in that area, because we want to be a good partner.
Okay. And correct me if I'm wrong, we, Cherokee Nation, will be treating beneficiaries there.
Absolutely, yeah.
We'll be treating non-beneficiaries there, and OSU personnel is going to treat the non-beneficiaries.
Yes.
Okay, so that is, yeah, it's a pilot, all right.
Yeah.
Okay. Any questions for Dr. Jones? Thank you, Dr. Jones. Okay, any announcements? Huh? We do? Okay, all those in favor of this resolution, say aye. Aye. Any opposed? Motion passes. Any announcements? The only one I see is for the next meeting is tentatively scheduled for Tuesday, October 15th at 1 p.m. I need one more motion. All those in favor? Aye. Motion passes.